How Kentucky became a surprising leader in flattening the curve on COVID-19. Gov. Andy Beshear's rapid response to the coronavirus has drawn national attention and turned him into a social media meme. I'm fascinated by the theoretical idea that the US state responses will provide 50 little test cases in how to respond to the virus, since each one will have slight differences, but given how interconnected the country is, I'm not convinced there's all that much each state government can do. Despite the interconnectedness, I think you're right. There's a lot of variables at play, so one should be careful to draw narrow conclusions. For example, Republican vs. Democrat governor might be interesting, but states that elect a particular party might have a confounding factor, like urban versus rural, agricultural versus manufacturing, education level, income level, state budget surplus versus deficit, social norms, proximity to international travel hubs, etc. Still, in the end analysis, some trends might stand out, even after controlling for confounders. Some trends might be predictable today, others might only make sense in hindsight. Well, Mississippi is pretty rural, so that is a huge help if I'm not mistaken. Speaking in terms of coronavirus here. Helps to slow the spread, but it won't help prevent deaths. The rural South is unfortunately not known for having great health or medical infrastructure. Yet especially where I live, I think there's 24,000 people live in my county, and I live in the swamps in the BFE. But I got family that lives on the coast, about 35 minutes from me, and there's a shit ton of people acting like this is a vacation. And there is a lot of senior citizen that live on the coast I'm worried about pensive face. My town of 3K people has been on lockdown for 2 weeks, despite the nearest case being 100 miles away. That was supposed to end on Monday, it's now been pushed another 2 weeks. Look at schools for an example. Ohio shut down schools statewide almost 2 weeks ago, and 3 days before any other state. There have only been 2 cases of teachers with the virus, versus New York City, where de Blasio refused to shut down schools until a few days ago. There are at least 80 confirmed teacher cases in NYC. Think of how many kids and adults those teachers were in contact with while working. Things like that really can make a difference in a state level. You make a good point, but NYC schools closed on March 16, so it's already been over a week. NYC will see more cases in general because of its density and how people rely on public transportation. Also, it was probably here in higher numbers before it hit at least in the same way. I am from New Jersey, but NYC is here for me, haha. Cuomo was the holdup for de Blasio in the early weeks, though he's ramped the entire state up since then. The mayor wanted to shut the city down except for essential jobs, and Cuomo kept insisting that he couldn't imagine NYC becoming like Italy. Welp. I don't know why everyone remains so charmed with Cuomo. He has a great presence but made literal criminal decisions in my opinion. De Blasio is not my favorite person but was the most level-headed one, ready to handle this as it should have been. Cuomo has since stepped up well, I feel, but it was like his usual self in the early days, waiting for political consensus before doing what was needed. The dumb thing is we already did this once before 100 years ago in 1918. Some cities, like St. Louis, locked down early and hard and saw few deaths over a longer period. Pittsburgh threw a WW1 parade and had a massive spike of deaths and shorter timeline. Lots of unnecessary deaths. Denver locked down and that stopped the deaths. 5 weeks later they said it was too damaging to the economy and reopened the schools and businesses. A second spike followed, so they locked down again.